everybody, welcome to Into Health. Today I'm going to show you some exercises for any sciatica pain. So first of all, I'm just going to show you where it goes through the body. So the sciatic nerve is quite a long nerve. It starts, so it has innervations from L4, which is around here, all the way down to S3. So it has branches of the nerve that come out from every vertebra from L4, L5, S1, S2, S3. So all the way from here. Then it branches into one nerve and it comes across the buttock. Sometimes it goes across this piriformis muscle, which is from here into here. And then it goes to the back of the leg. From here it branches off. One branch goes down into the heel, another branch comes around into the side of the leg, another branch goes inside the inside of the lower leg, okay? So most of the time sciatic pain will be caused by inflammation of the nerve when it gets pinched anywhere down the leg from injury or an accident. It could be a herniated disc, or it could be something more serious, but we're not going to talk about that. First of all, I would always say that if it persists for more than 2 weeks, you need to go and see your doctor. And here in the UK, the process is that if you go to the doctor will prescribe painkillers for about 2 weeks. If the pain persists, you're going to go back, and then normally the main thing is that they'll wait until 6 weeks, because a big study showed that within 6 weeks 60% of all back pain will clear, and then after the 6 weeks they will refer you on. So the earlier you go, the better. And just bear in mind that within 6 weeks, most of the time the pain will go by itself, but there are also exercises that you can do. And if it is a recurring problem, you probably need to do an MRI or an X-ray to just check that you haven't got a herniated disc or any disruption, any structural problem into the back, or anything more serious that could be pinching into the nerve, okay? So I'm just gonna show you some simple exercises that you can do that can relieve the sciatica pain. The first one, which is one of the easier one, and is basically using the flossing method of the nerve, is to lie down onto your back. Now, you don't have to do this on a mat. You can do it in bed, so you don't have to go down onto the floor, especially if the sciatica is acute and you can't move very easily. So you're on your bed, you're lying down. Now, the easier way is to have both knees bent. Otherwise, you can straighten one leg. You're basically bending the knee, bringing the leg parallel to the floor, grabbing hold of the back of the leg. Now the head should be down onto the floor, it shouldn't be up. If it raises up, use a pillow behind your head, and then tuck the chin to the chest so the neck is nice and long, and then you're straightening the leg, pointing the toes down towards the floor. And then we're going to do the flossing. So basically, if there's anything that is stuck in this inside the spine, within the spine, the spine will basically undo it, okay? So on the inhale, you're lifting the head up, point the toes up towards the ceiling. On the exhale, relax the head down onto the mat, point the toes down towards the floor. Inhale, point the toes up, lift the head. Exhale, point the toes down, bring the head back down. Bend the knees, and then you do it on the other side. Grab hold of the back of the leg, straighten the leg as much as you can, point the toes towards you, tuck the chin to the chest, and then on the inhale, point the toes up, lift the head up. Exhale, point the head down towards the floor, point the toes towards the floor. Inhale, point the toes up, lift the head. Exhale, bring the head down, point the toes down. You're gonna do this 10 times on each leg, and then you can bend the knees. This all can be done in bed. Keep the knees sort of together, and then you're bringing the knees together, and you're bringing the knees about a 45-degree angle from you, and then the other side. So this gives a little bit of a massage on your back. You don't want to go all the way down,
yeah, because it gives too much twist to your back. You're just going for to 45 degree and then a 45 degree again. And then from here you can keep the left leg, one leg bent, the other one you're pulling it towards your chest. This is to release the lower back, and then you can do it on the other side. Okay, so if you're on your acute face, you're gonna do this with the addition of one more, which is a stretch to that piriformis muscle that I was talking about in the glutes. So you're basically bringing the right foot on top of the left knee. You're flexing the foot, so you're protecting your right knee, and then with your hand you're opening the right leg out to the side, pushing the hand down until you feel the stretch in your glutes. If you want more of a stretch, again, make sure that the head doesn't lift off the floor. You're grabbing hold of the back of the leg and bringing that left leg towards your chest. Tuck the chin to the chest so the neck is nice and long. Wherever you are, you just want to feel the stretch, you don't want to feel pain. So if this is as much as you can do at the beginning, and if you cannot bring the leg out too much, then just do this and try to push the knee out to the side, okay? Eventually you get to the point where you can open the leg out to the sides. So these are the 4 exercises that you want to do if you've got an acute case of sciatica. And then one more thing that you can do, which is the Mackenzie stretch, which is basically used to release any herniated disc or any problem within the lower back. You're lying on the floor. You're placing your hands so that basically your elbows are underneath the shoulders and you're coming up. If this is too much, you start with the hands underneath the shoulders and you're just coming up. But I find that with the elbows underneath the shoulders, it's a little bit easier for the back. Otherwise, you're relying on the back to lift yourself up. And then you're just staying here, looking just beyond the hands. And you're feeling, you can stay here to the count of 10 to start with. And then you go all on and on until you can get about a minute into this position, okay? Once you've done this one, you place your hands underneath your shoulders, you're tucking the toes under, and you can also go into child pose. So you can release the lower back into this position. You don't want to do these ones until you're feeling confident that you can go and lie onto your front without causing any pain onto your back and into the sciatica, okay? So the first 4 exercises are for the acute phase, and this is more to sort of release that herniated disc, but then you want to go also and do some exercises to strengthen the core muscles, so that basically you're strengthening this whole area of the body so that the recurrence of sciatica diminishes more and more. Okay, thank you for watching today.